Hi, my name is Lisa Evangelista. I'm a nurse that works on a stroke unit, and so I'm here to educate you a little bit about Healthy People 2020 Heart Disease and Stroke to help you with stroke awareness and prevention. So what is a stroke? Probably a lot of you out here right now are probably thinking, what is a stroke, or how can I possibly prevent it from happening? So a stroke is something that happens when the blood flow in the area of the brain is actually cut off. So when that happens, a stroke can cause permanent loss of speech, movement, and even your memory. So just remember there's different types of stroke as well, and signs and symptoms to look for. So a few of the different types of stroke, just so you guys will know, is a hemorrhagic stroke, an ischemic stroke, and also a TIA. So I'm going to go into a little bit further explanation of what these actually mean. So a hemorrhagic stroke is either an aneurysm, which is a burst of a blood vessel that has been weakened, and it can be responsible for 40% of all the strokes. So an ischemic stroke now is something that occurs with a blood vessel carrying that is an actual blood clot that can be caused when it doesn't reach the brain, and this can also happen because of high blood pressure. It's one of the main causes of stroke. So when you don't go to your doctor's appointments and you don't know what your blood pressure is, this is a main cause of how stroke can actually happen to you. So ischemic strokes can account for 80% of all the strokes out there. Again, it's because of the high blood pressure that people are unaware of. So definitely go out to your primary care physicians and let's get educated about our blood pressures. So now a TIA is also something that happens quite often in the hospitals as well. It could happen very simply when somebody getting some signs and symptoms, and these symptoms can last for 24 hours. They disappear within 24 hours. It can actually be as quick as 15-20 minutes at times, and then your symptoms disappear, so a lot of people won't go to the hospital and get checked out. So some of these signs and symptoms to be aware, whether it's your family, your friends, your loved ones, is if you start seeing anything of a facial droop, and right here is a nice little handout that you also have in your packets that I've given you guys, and then facial droop, arm drift, and slurred speech. These are your main ones. This is when you want to call 911. You want to get to a hospital immediately. This is something that they can help you intervene a stroke. So besides your signs and symptoms, another big thing is modifiable risk factors. These are things that you can actually change on your own. These are things that you can change. So you actually have to put an effort into it, everybody. So a couple of these things is high blood pressure, smoking, diabetes. That's if you do have diabetes and you want to be on a diabetic diet. You want to cut out that sugar. So you want to really pay close attention to how you're monitoring your diabetes. So physical activity is huge. You want to get out there. You want to at least walk. Take a bike ride, swim, do something, get active. Obesity is not good at all, especially with our age as we getting older, as we all know, and it's a lot harder to lose that weight at this age. So, and high cholesterol, if you do get your cholesterol tested at the doctor's office, there's something called HDL and LDL, and if your LDL is too high, then you're gonna go on medication to help you go ahead and bring that down.